Welcome to the Hospital of the University of Pennsylvania, the flagship hospital of Penn Medicine, where our world-class faculty and staff are dedicated to superior patient care, education, and research for a better, healthier future. We're excited to provide you with an overview of our hospital and pharmacy department, so you can get a sense of what it's like to be a pharmacy resident at HUP. We will highlight some of the key areas where you will work and spend your time as a resident at the hospital. We'll start by showing you our residents' home away from home, the resident room. The resident room is an office space adjacent to the central pharmacy, housing personal workspaces for all PGY1 residents and most PGY2 residents. Here, residents are found working at their desks, indulging in some of the many shared snacks in the room's mini fridge, and chatting about their rotations.
Hi everyone, welcome to our resident office.
This is a protected space for all of our PGY1 and PGY2 residents to work up patients, attend meetings, or hang out on our free time after our rotation responsibilities.
Each resident desk includes locking drawers, a laptop, and a desktop with docking station capabilities. As you can see, we've made our home away from home more enjoyable with pictures and decorations at each desk. As you walk down the hall, you will pass the pharmacy conference room, commonly referred to as the PCR. The PCR is where you will have many meetings, lectures, presentations, and learning events throughout your time as a resident. At the end of the hallway, you will reach the administrative offices for the department. PGY1 RPD Nikki Patel, as well as other administrators, managers, and clinical specialists, have offices in this hallway. One of the best parts about all of the managers and preceptors at HUP is that they have an open door policy and encourage residents to stop by for anything, even if it's just to say hello.
Hi everyone, welcome to HUP. I hope you're enjoying your tour of the department.
At the Hospital of the University of Pennsylvania, we have two main inpatient pharmacies to accurately fill medications to be dispensed to different patient care areas. There are always a few friendly faces working hard in Central to ensure that patients get the medications they need in a safe and timely manner. Pharmacy production is an area tasked with compounding non-sterile products for inpatients, outpatient clinics, and outpatient pharmacies. They make things like creams and lotions, oral suspensions, and capsules. Let's take a sneak peek into the non-sterile compounding area, where you can see how technology is actively helping in our daily dispensing process. With the assistance of AutoPrint and Fluidos, our non-sterile compounding process can remain both seamless and efficient. In the middle of the Pavilion Central Pharmacy is the hub of the inpatient pharmacy. It is where our XR2 automated dispensing system fills both Omnicell restocks and patient-specific orders, and where technicians prepare products to be sent on hourly medication deliveries to patient care areas. For sterile compounding, our IV room is currently housed in the pavilion side of the hospital, which is equipped to prepare sterile products like intravenous admixtures, intrathecal preparations, and hazardous sterile products. Both sides of the hospital have a controlled substance room. This includes receiving orders, preparing supplies for the automatic dispensing cabinets, handling narcotics returns, and completing cycle counts. Just a couple of floors up, we can observe some of the pharmacists in action in the patient care areas. Our preceptors are composed of unit-based clinical pharmacists and clinical pharmacy specialists. Over 80% of our preceptors are board certified or have completed a fellowship. Unit-based clinical pharmacists, UBCPs, at the Hospital of the University of Pennsylvania have workspaces reserved directly on patient care units, such as in the emergency department, medical ICU, general medicine floor, and more. In this decentralized model, pharmacists work closely on the units with nurses and providers to ensure optimal patient care and distribution of medications. They have a lot of responsibilities, including rounding with their team, verifying orders, completing consults, assisting with antibiotic selection and dosing, counseling patients, and much more. Our residents have the opportunity to serve as unit-based pharmacists on some of their weekend shifts. Our department also has a large team of clinical pharmacy specialists. Clinical pharmacy specialists work closely with the patient care team to devise therapeutic and drug monitoring plans and partner with the unit-based pharmacists to provide pharmacy services to our patients. They participate in committees and work with others in the health system in developing guidelines and protocols for clinical practice. While the pharmacy department provides a large scope of services to our patients in the hospital, the department also offers many services to patients in clinics and through our outpatient pharmacy. Let's take a quick walk across the bridge to the Perlman Center for Advanced Medicine and take a look at some of these areas. The Perlman Center for Advanced Medicine, also called PCAM, is a state-of-the-art outpatient facility with over 50 clinical practice sites. We can head up to one of the clinics now and check in with one of our ambulatory care pharmacists. Ambulatory pharmacy services extend to a multitude of interdisciplinary practices, including cardiology, oncology, and infectious diseases, as well as specialty clinics such as rheumatology, neurology, pulmonology, and more. These pharmacists provide several services, including medication management, drug interaction assessment, educating patients and providers, and assisting with patient access and compliance. All of our clinics share a common goal of providing comprehensive, patient-focused care. PCAM also contains our outpatient oncology clinics and infusion center in the renowned Abramson Cancer Center. There are 3 floors housing laboratory testing space, clinic rooms, and the infusion suites. Each floor has its own infusion pharmacy, servicing up to 30 infusion rooms per floor, and the Oncology Evaluation Center, which serves as an urgent care for oncology patients, open 7 days a week. The infusion pharmacies have a specialized clean room and trained staff to mix hazardous medications for the 300 patients they see daily. The pharmacists are involved in verifying chemotherapy, checking the mixed products in the clean room, educating patients about their chemotherapy prior to the first infusion, and follow-up visits as needed. We also have 2 outpatient pharmacies at HUP. PCAM Outpatient Pharmacy is a specialty pharmacy located on the 1st floor and serves as a key resource to our clinic patients and employees. The pharmacy staff has an incredible turnaround time for prior authorizations, as well as access to many specialty medications, which is vital to providing the best care to our patients. A unique aspect of HUP Outpatient Pharmacy is My Pen Pharmacy. This is our Meds to Beds program for our inpatient teams. Inpatient providers send prescriptions to the pharmacy, and MPP technicians fill and deliver them directly to patients or their nurses prior to discharge. This helps support medication adherence, since patients don't have to pick up prescriptions following discharge. Just one last stop before the tour ends. While there are a ton of great options to grab lunch or order takeout nearby, most days we head to the cafeteria to grab a quick bite, so let's stop by and check it out. The cafeteria has a wide variety of good options to select from for breakfast, lunch, or dinner, and offers a place to sit and take a quick break when you need it. We also have a Starbucks located right next to the cafeteria in case you are in need of a caffeine boost. A lot of our residents have opted for a coffee membership at our HUP favorite, Root and Sprig, for unlimited specialty coffee. Well, that concludes our tour for today. We hope you enjoyed this virtual tour and got a good feel for the hospital, the Department of Pharmacy, and some of what you will be doing as a HUP resident. Thanks for watching.